very big group today, which is great to see as researchers. We really like it when our results are disseminated and made use of. So we're happy to have everybody here. I'm Kareem Kaisia. I'm the Director of Vulnerable Population Studies at NORC at the University of Chicago. And I'm joined by my colleagues, Shanto and Letitia, and I'll let them introduce themselves as well.
Hi, good morning, good afternoon, everyone. My name is Shanto Sadhu. I'm a senior research scientist at NORC, and I'm the principal investigator of this study, and we'll be discussing a lot of findings with you guys. Thank you.
Good morning, everyone. My name is Letitia Onyango. I'm a researcher here at NORC, and I led the design and analysis of the qualitative portion of the study, and I'll be discussing those findings.
So just so everybody has a general idea of the structure here, it's a large group. So we're going to keep everybody's videos and microphones off. However, you are going to be able to ask questions in chat. You'll see there's here, ask questions here. Sarah, do you want to raise your hand so people see you? So you can send your questions there. We're going to collect all of the questions. And then after the presentations, we're going to hope to go through, the questions that people have as well. But let's all keep our videos off, please. I want to start by, there were so many people that worked on this project. And I want to start by thanking the governments of Côte d'Ivoire and Ghana for making themselves available to us throughout the research process. I also want to thank the World Cocoa Foundation, who also made themselves available throughout the research process, and the Department of Labor, who provided funding and oversight of the project. And just it's important to note that everything we present here today doesn't necessarily reflect the views of the Department of Labor. We were definitely like an independent research organization on the ground there. I also want to thank multiple international organizations that took part in the research, and that includes the International Cocoa Initiative, the International Labor Organization, and UNICEF. There were also multiple NGOs and CSOs involved throughout. Most importantly, I want to thank the people in Côte d'Ivoire and Ghana for making themselves available to the researchers. The surveys could take upwards of almost 3 hours to complete, and everybody was very gracious in giving us their time. I also want to thank Kantar Public, who was our local data collection firm, really helped us navigate the environment in Côte d'Ivoire and Ghana, and definitely the success of this project. And they also provided hundreds of enumerators, local enumerators, to collect the information there. I am going to share my screen and jump in, because even though we've got 2 hours, you'd be surprised how much information we're trying to cover. So again, this is the Assessing Progress in Reducing Child Labor and Cocoa Production in Côte d'Ivoire and Ghana project. I also want to note that it's a big group today. There's lots of different stakeholders here. So we're going to try and present information that's going to be of interest to everyone, including, people invested in child labor, invested in cocoa. There's government officials, reporters, NGOs and CSOs are all represented today for this presentation. One thing that's important is we're trying to focus the presentation to be helpful for funders and NGOs who are working on the ground in Côte d'Ivoire and Ghana. In the end, the purpose of this research for us is to try to improve the lives of children. So we want to try to provide as much information as we can to help people in understanding the issue, and then also, how to confront the issue. Again, the funding for this report was provided by the US Department of Labor. And I want to just give a little bit of background on how this project came about. So this project came about through the Harkin-Engel Protocol, which was a protocol put into place over 10 years ago that brought together the governments of Côte d'Ivoire and Ghana the international chocolate and cocoa industry represented by the World Cocoa Foundation, and the US Department of Labor, right? And all of these stakeholders came together to confront the issue of child labor and hazardous child labor in the cocoa supply chain. As part of that protocol, there were every 5 years a survey took place in order to gauge the progress towards reducing child labor and hazardous child labor. Those surveys took place in 08, 09, 13, 14, and now 18, 19 is the final survey round. And we're presenting not only point estimates for 18, 19, but also comparing the data across longitudinally across all 3 survey rounds. The main objectives were to conduct this survey in the 18-19 cocoa harvest season, and then develop population estimates for the prevalence of working children, child labor, the worst forms of child labor, and then use those estimates to measure changes in prevalence over time. And just some information, we conducted household surveys, child surveys, community surveys. We had a cocoa shed survey. A cocoa shed is a location where farmers in the area can all go to bring their cocoa where it undergoes light processing before being sold, and also school surveys. It's also important to point out that our survey was focused on child labor and hazardous child labor and not focused on slavery or human trafficking. You know, if we were going to study that, it would take a completely different methodology. And then it's an important issue though, and should be studied in the future. So I believe in chat, we've shared some documents that are going to help orient people as we go through the findings. This is a good way to understand what is child labor and hazardous child labor. And you should have that handout and you can look back to it as we're talking and study it. But essentially, our definition of child labor, which is set as part of the Harkin-Engel protocol, will look at child labor as any child in these different age groups that work more than the allowable number of hours in a week, right? So you can see for 5 to 11-year-olds, that is 1 hour or more in a particular reference period. So for our study, we collected data both on 7-day and 12-month reference periods. However, our analysis is over the 12-month span in order to understand the seasonality involved in cocoa production. It takes place over the entire course of the year. Even though there's a main harvest season, there's also preparation before that. And that's child labor. Then we also look at hazardous child labor. And this is very important, and we'll go into more details on it. But hazardous child labor, a child is categorized under that if they take part in land clearing, carrying heavy loads, exposure to agrochemicals, sharp tool use, long working hours, or night work. And then to go even deeper, each of these has subcomponents of what does it mean to carry heavy loads? What does it mean to be exposed to agrochemicals? So that way, not only can we report on hazardous labor, but people on the ground can look at this data and understand exactly the component parts of hazardous labor. Like, what are children actually doing? And when you look at it that way, it really brings out the complexity of the system and allows you to design interventions that could be focused, you know, on exactly what children are doing. This is our measurement framework. And again, it's just to help people orient people on what we're doing. So first, we're looking at children in cocoa growing areas, right? So this isn't nationally representative. The survey was representative of children in the cocoa growing areas. From there, we split them into working children in cocoa growing areas and non-working children. And we're really just focused on the working children. Within working children, we look at children working in agriculture, and then we look at children not working, but not in agriculture. Maybe they work at the market, you know, there's all sorts of other jobs they could be doing. However, we're focused on agriculture. Once you go into agriculture, we look at cocoa-related activities, and then we look at agriculture with both cocoa and non-cocoa related activities. So that's like all agriculture. We go down another level, and that's where child labor kicks in, and we're able to report on child labor and cocoa-related activities. And we also have information on child labor among children working in agricultural households that have both cocoa and non-cocoa. From there, we take it down to our last level, which is hazardous work. And again, we can look at cocoa-related activities and hazardous work and agricultural activities writ large, both cocoa and non-cocoa and hazardous work. So there's a lot of data that we have as part of this project. We're only presenting a very small subset of that data today. The rest of the data is going to be made publicly available very soon. And I encourage people to use that data. I mean, you could write 5 300-page reports with the data that's out there right now. The other thing to understand is how we split, our analysis. We look at long-term comparisons for agricultural households. We call these historic trends. And then we look at also recent trends from 1314 to 1819 among cocoa growing households. So in the report, you'll see us going back and forth from agricultural households to cocoa growing households, looking at the long-term trend and also the short-term trend. And going back and forth gives you a lot of information about what's happening on the ground. However, importantly, when looking at agricultural households, right here you'll see that 86% of the agricultural households that we looked at were also cocoa growing households, right? So we have to be very precise in our report and our findings. But as you can see, when we talk about agricultural households, the majority of those are also cocoa growing households. Now I'm just going to go quickly through some high level findings. Here are the numbers that everybody likes quoting and looking at. In terms of child labor, 1.56 million children across Côte d'Ivoire and Ghana were categorized as child laborers. Of that, 1.48 million children were also categorized as hazardous child labor, right? So as you can see, the majority of children, if they're in child labor, they're doing at least one hazard involved with that. And my colleague Shanto is going to talk more about the hazards and interesting ways you can look at how to analyze the component parts of hazardous child labor. A 2018-19 snapshot can show you the child labor and hazardous child labor rates in terms of prevalence, right? So overall, within cocoa growing areas of Côte d'Ivoire and Ghana, 45% of children in agricultural households are involved in child labor. And then in hazardous child labor, it's 43%. So you can see that, there is an issue of child labor and hazardous child labor, in this area. However, you also want to recognize that these are farming communities, smallholder farms, where children are mostly working on the farms owned by their parents. So there's some interesting findings that we found, and this shows the historic trend from 08-09 to 18-19, right? And from that period of time, you've got a 14 percentage point increase in child labor and also a 13 percentage point increase in hazardous child labor. However, among the same period, you had a 62% increase in cocoa production. And that increase in cocoa production can be related to many factors. There's better farm practices, there's increased, agricultural inputs, extensive use of pesticides and herbicides, which all increase yields. But we're also seeing a large growth in the number of farms dedicated to cocoa. Cocoa is an extremely lucrative farming activity in West Africa, and you can see more and more farms are opening up. So that, in doing that, the data also revealed some very interesting trends in terms of production areas. So we split our sample up into high production areas, medium production areas, and low production areas, right? And what we found is child labor rates remain stable in the high production areas, over the historic trend. However, if you look at the medium production areas and the low production areas, you found significant increases in child labor and hazardous child labor. And the same, the hazardous work in high producing areas remained stable. In medium producing areas, it increased from 33% to 46%. And in low producing areas, it increased from 6% to 32%. So what does this tell us, right? So what this tells us is that in high cocoa producing areas, those areas are saturated with cocoa farms. And as cocoa farming expanded, it expanded into medium and low, cocoa producing areas. At the same time, what our data is showing us is that the majority of interventions were focused on the high cocoa producing areas, which makes a lot of sense, right? If you're an NGO, even government actors, and you're thinking, well, where am I going to put my money? Where am I going to put my interventions? The first thing you're going to think is I'm going to put it where the most cocoa is, right? And we believe that's what people did. And cocoa, child labor stabilized in those areas. However, by doing that, it started to expand in medium and low production areas, child labor took off, right? So what, at least as part of my presentation, and let me stop the sharing there. As part of my presentation, the takeaway there for NGOs and CSOs and people who design these things is you want to be careful when you start. You think you're focusing maybe on the right area, but you need to understand the context within which the interventions are taking place, and how, although you're focusing in one place, other places might also suffer from that issue. There's a lot more findings in there, but I'm going to turn this over to Shanto to talk about the interventions themselves as well as hazardous child labor.
Thank you, Karim. And I will be presenting some findings in two parts. In the first part, I'm going to talk about the importance of hazardous child labor and some interesting findings from our study. And in the second part, I'm going to talk about the findings from the second objective of this study, assessing the progress made in reducing child labor, specifically focusing on intervention efficacy, trying to understand what intervention works and what are the overall lessons learned. So in terms of these two parts, I will be presenting a lot of data and information. So, please bear with me. And again, one important part is that it's a huge report and a lot of methodological discussions are there in the report. For details, please refer to our report. And if you have any questions, let us know. We will try to address as many of those as we can. So let's start. Let me first share my screen. Okay, can everyone see me, Karim? The screen is sent.
Yeah, we can see.
Yes, Shanto.
Okay. So I wanted to start where Karim left, specifically discussing about the importance of hazardous child labor. So what we have seen is that there is an increase in hazardous child labor in cocoa production over the past 10 years. And it is important to understand, in addition to the overall increase, what happened to the various components of hazard. Because as you know that it includes the hazardous child labor includes 6 different types of hazards. And that's why it is important to understand how the component part of hazard, information regarding the component part of hazard. So from that perspective, we start with describing what are the most common types of hazards faced by the children working in cocoa production. And from our data, we see one of the most important or most frequently faced hazard is use of sharp tool. For example, using machetes, harvesting hook, knife for breaking cocoa pods, and handling, different types of mechanized motors for different purposes. Then the other part of the hazardous child labor, which is also very frequently, experienced by the children, or is carrying heavy load. For example, load of cocoa bean, or even, load of woods, and carrying water for different activities. And the next one is exposure to agrochemical, which is to say that children are involved in either spraying agrochemical themselves, carrying water for spraying, or even handling a bag of fertilizer, or using or cleaning up the bottles or containers of agrochemical, and even being present in the vicinity of farm when, let's say, the spraying is going on. Then the other part of the other component, which is also very frequently faced by the children, is undertaking land clearing. For example, children are used to clean the land in the cocoa farms, felling and chopping of trees, cleaning of field, or burning of fields. And if we look into the different components, the prevalence of different components, the data for 2018-19 shows us that 36% of children in the cocoa growing areas were exposed to use of sharp tools. And then 29% of children in the cocoa growing areas of Côte d'Ivoire and Ghana were exposed to carrying heavy loads. Then 24% of children were exposed to use of agrochemical, either directly being involved or indirectly involved during the application of pesticides. And then 19% of these children were involved in land clearing activities. So we do see that a significant portion of children have been working into facing different types of hazards. Now, this is the snapshot for 2018-19. However, it is also important to assess the picture when we are looking over time, that what happened to these different components. Like, for example, if one component has increased over time or the other component has gone down. So it's important to present the trend in changes in exposure to different components. So now we look into that trend, and looking into the trend of different components, we find some interesting and I think very important facts from the data. Our data indicates that there has been a significant increase in agrochemical exposure of children between 2008-9 and 18-19. So 5% of children in 2008-9 were exposed to agrochemical, and that has increased to 24% in 2018-19. And we also looked into the different other components. The other components also increased, but by much smaller extent relative to the increase in agrochemical. And when we look into the agrochemical exposure incidence across, breaking down by country, we do see the same trend in both countries, Côte d'Ivoire and Ghana. There has been a significant increase in exposure to agrochemical over time. So that actually brings us to the question that what's happening on the background? Can we have any other explanation from our data? And as Karim mentioned before, in our survey, we have a lot of data collected. So we tried to explore what happened in the background between, let's say, in the recent times, 2013, 14, and 18, 19. So we looked into the incidence of use of agrochemical among the cocoa growing households. So what we found from the data is that there has been a significant increase in the usage of agrochemical product among cocoa growing households between 13, 14 and 18, 19. And this increase is actually like in terms of a greater proportion of cocoa households are using agrochemicals. And at the same time, they're using more because expenditure per ton of cocoa produce has also increased significantly. So from that particular perspective, it is quite natural that if more households are using agrochemicals, probably the children will also be involved because they might carry a bag of fertilizer, or they might clean up the containers used for agrochemical applications, or they might be present when their parents are actually spraying pesticides. And to the worst possible scenario, they have been undertaking those work by themselves. So we feel that given this information that we have in our data, significant increase in usage of agrochemical probably is correlated with increase in children's exposure to agrochemical product, and that's something we need to discuss more in details in future from the program implementation perspective. Now, once we know the trend, it is also important to understand what happened to these children in terms of their exposure, how many types of hazards they are exposed to. And we're very interested to understand whether a particular child is doing maybe one or two types of hazards, or they are doing more than two types of hazards, because involvement in multiple hazards can have severe health consequences. So we actually looked into the incidence of children facing different types of hazard by counting how many types of hazards from the 6 different varieties of hazards we captured a child was exposed to. So our data actually indicates that a significant proportion of children who are working in cocoa production were exposed more than one hazard. And specifically, if you look into the aggregate sample, which is covering both the cocoa growing area of Côte d'Ivoire and Ghana, we do see that approximately 70% of those who are working in cocoa production were exposed to 2 or more hazards. And once we look into the other one, for example, we do see a green picture. For example, 45% of the children working in cocoa were actually doing 3 or more hazards. For example, they are doing agrochemical exposure, they are using sharp tool, or they are carrying heavy load. And finally, the last part, if we see in terms of the exposure to 4 or more, which is probably the worst possible scenario, they are doing almost all of the work and all of the most frequently done work, we see that 22% of children in this cocoa growing area of Côte d'Ivoire and Ghana were exposed to 4 or more hazard. And the picture and the breakdown of the country shows similar type of statistics. And that actually tells us that significant proportion of the children are exposed to, who are working in cocoa, are exposed to multiple hazards, which is definitely a big concern. Now, it is also important to understand the trend in their exposure, right? Because ideally, we expect that with interventions, there will be a reduction in the number of hazards children are involved to, because most of the interventions target to reduce children's exposure to different types of hazard. So we would expect to see that the proportion of children, working in this cocoa fields or in cocoa production, what's happening to their exposure. And for that particular purpose, we looked into the extreme vulnerability. We tried to figure out what happened to the proportion of children who are doing 4 or more hazard, because that will give us a picture of the real in the ground. And comparing the data between 2008-9 and 18-19, we find a pretty challenging situation here. We see that the percentage of children who are involved in 4 or more hazard has gone up significantly between 2008-9 and 18-19. As you can see in the aggregate sample, it went up from 7% in 2018-9 to 22% in 2018-19. And similarly, for each of the individual country, we do see a significant jump in the proportion of children who are engaged in 4 or more hazard. So basically, it is actually telling us that more children are becoming highly vulnerable, which is definitely a very important consideration that we need to take into account. And we will come back to this again, but at this point, looking into this data, we feel that this particular problem, as we have seen or identified from the data, actually tells us that we need to identify and target the households with highly vulnerable children, because obviously, the resources are limited. The amount of expenditure on different types of intervention are being, spent by different institutions, including the government, the industry and other international donors, as well as, civil societies and so on. We need to find out how that can be made more effective. And basically, given this grim fact that we have seen significant increase in vulnerability of children, we need to have more targeted interventions focusing on the most vulnerable households, because that is the most important. I mean, I think that is they are facing the worst possible scenario on the ground. So we'll talk a little bit more towards my presentation on that, and I would love to hear your voice and your thoughts as well. Now, in the second part of my presentation, I'm going to focus on the findings from our assessment of intervention effectiveness. And specifically, as we mentioned, our second objective of this particular study was to find how effective are the interventions, looking into different types of interventions, and as well as trying to find out, can we learn something from these interventions for future? What's working, what's not working, and are they working at all? So in order to address all of these questions, we conducted an assessment of effectiveness of different types of intervention. And there we try to look into overall effectiveness, and then what are the achievements, what are the lessons that we learned, and most importantly, we also explored the sustainability of intervention, because we know that solving the problem of child labor will not be, it's not a short-term goal. We have to continue, because it's still almost 1.56 million children are working in these conditions. So we need to figure out how to make the intervention sustainable over time. So we also explored that. And specifically for our assessment, given that there were so many different types of interventions, we actually focused on thematic areas rather than individual projects. For example, we looked into the effectiveness of what's happening with respect to the livelihood services provided by different partners, what's happening with the awareness campaign programs, what's happening with the educational material assistance. So we looked into these as a group, as a thematic area rather than individual intervention. Now, from that, keeping those in mind, I would like to present the findings of the study. And again, it's a mixed method assessment where we address set of research questions, as we mentioned, in terms of the sustainability, in terms of the different lessons learned and so on, using a mixed method approach, which combines a rigorous analysis of quantitative data using both survey data and the data from intervention, which is provided by different stakeholders. And we also used qualitative data from the focus group discussions with the beneficiaries and children and the caregiver, as well as key informant interviews of different stakeholders. My colleague Leticia is going to talk more about the findings from the qualitative assessment. And while I'm going to focus mostly in coming 10-15 minutes on the findings of the quantitative analysis of data on assessment effectiveness. So basically what we have done in our quantitative analysis, as you can see, it's a very there are a lot of methodological discussion in the report. And I would like to minimize those and try to focus on the findings more because entire details it has been presented in the report. So if you have any questions about those, I will be happy to address later on. But for today's presentation, I wanted to focus mostly on what are the findings and what we can learn from them. So in our quantitative assessment, we used a quasi-experimental method, mostly to assess impact of implementation of multiple interventions in a particular community. And there we try to find out if the community receives different types of interventions, do we see there is a change in the prevalence rate? And we also look into the specific types of intervention, for example, effectiveness of educational material assistance, livelihood support program, effectiveness of occupational safety and health training. But for this presentation, I will be focusing mostly on the implementation, the impact of implementation of complementary interventions in communities, and try to understand whether or present the result on whether when a community receives variety of different interventions, the child labor and the hazardous child labor prevalence rates go down in these communities. So once again, the quantitative assessment that I'm going to focus here for this presentation will look into the impact of multiple intervention being implemented in a community. And the target is to find out whether that led to a lower prevalence of child labor and hazardous child labor rates. And for that, we used data collected from Côte d'Ivoire because sample size for Ghana was pretty small, which we cannot use for our quantitative assessment. And the details of that is actually in the report annex. So we explained why we are unable to use that. And while it's a very, I think like methodologically involving discussion, but I would like to minimize that and just to mention what we have done at a high level. So we have used statistical matching and regression analysis to identify the impact or estimate the impact of multiple intervention. So basically what we have done here is that we looked into the communities that received multiple intervention and try to find out, are there communities that in our sample that are very similar to the communities that received this type of intervention, but did not get any exposure to those interventions. So we used a statistical matching to make sure that the communities we are interested in, the treatment communities, and the comparison communities, which we'll be using to compare and contrast the outcomes, are very similar with respect to different characteristics that might influence implementers' decision to use programming in those village communities for programming. And then in the second stage, after we have identified similar set of communities, then in the second stage, we try to find out in the households living in these two group of communities, whether the child labor rates and prevalences are different. So that's in a nutshell, but the entire details is available in the report. So let's look into the results. So what we found out from this quasi-experimental design, we found that multiple interventions in a particular community led to statistically significant reduction in the prevalence of child labor and hazardous child labor. And specifically, we found that households in the treatment communities were 25 percentage point less likely to have at least one child engaged in child labor. So we basically, explored two different outcome measures. One is to see that what is the likelihood or chance that a household will have at least one child involved in child labor. And similarly, at least one child involved in hazardous child labor. That is the likelihood we're talking about. And the second outcome measure we also looked into is the rate of child labor in a particular household and rate of hazardous child labor. That, for example, if a household had 3 children, out of the 3 children, how many of them were exposed to either child labor or hazardous child labor? That is the rate of rate that we are looking into. So from this particular analysis, what we have seen is that we found that in the treatment villages or treatment communities, households were 25 percentage point less likely to have one child engaged in child labor, and also 28 percentage point less likely to have one child engaged in hazardous child labor than the households from the comparison communities. So it implies that once we control for different household and community level characteristics that typically influence children's engagement in child labor and hazardous child labor, if a household is living in the treatment communities that was exposed to multiple intervention, the likelihood of having children engaged in child labor and hazardous child labor was lower compared to the households that were living in the comparison communities. So next, we also looked into the results, with respect to the rate of child labor and hazardous child labor in the household. We find the similar outcomes here. Again, multiple intervention led to a statistically significant reduction in the prevalence of hazardous child labor and child labor in cocoa production in the households. So specifically what we saw is that if the household is living in a treatment village or treatment community, the rate of child labor in that particular household was 17 percentage point lower than the households that are living in the comparison communities. And similarly, the rate of hazardous child labor among households in the treatment communities was 17 percentage point lower than the rate in the households within the households in comparison communities. So combining these two, what we find is that if a community receives multiple doses of intervention, for example, 7 or 8 different types of interventions, we do see that prevalence of child labor and hazardous child labor in these communities are lower compared to the prevalence in the comparison communities, which are very similar to the treatment communities, but they did not receive such intervention. So which means that, which is at least give us some hope, which shows that if significant efforts are made in implementing multiple intervention in a particular community, let's say 5, 6, 7 different types of complementary interventions is implemented in a particular community, then prevalence rate of child labor and hazardous child labor will be lower in that particular community compared to the other communities. However, there is a note of caution. Number one, these results, it has been obtained from Côte d'Ivoire because of data limitations, we only focused on Côte d'Ivoire. And it had, so essentially we don't know anything about Ghana. Hopefully we'll learn more in our future studies. And also it is very important to understand that only even less than 25% of all communities we sampled, for example, out of 150 communities, less than 25% of such communities had 4 or more interventions. And if you go further, asking the question, okay, how many communities received, let's say 6 to 7, different types of intervention? The number is even lower, even less than 15% of communities receive such interventions. So which tells us that even though we see that implementation of multiple intervention is really effective, only very few communities are currently receiving it. So it definitely tells us that we need to do a lot in addressing child labor. We need to scale up such interventions into many communities. Unfortunately, currently, in spite of the effort made by the governments, in spite of the effort made by industry and different multilateral institutions, donors and other NGOs and CSOs, still we are able to reach only very few communities with highly invested interventions, which can have impact on child labor and hazardous child labor rates. So really we need to do much more than what we are doing right now. And finally, I think, I would like to talk very quickly about the future research. And as we have seen before, right, we know that if we are really investing in a particular community, we are able to reduce the prevalence of child labor and hazardous child labor, at least from the results that we have received, we have seen from Côte d'Ivoire. However, it is also important to understand that we have not explored what happened to the exposure to multiple hazards. For example, are these interventions effective in reducing exposure of children to 2 or 3 or more hazards, right? That's an important question because we know that has gone up over time, and at the same time that can have significant implication on the health and welfare of children. So we do need to understand the intervention effectiveness and figure out whether the interventions are effective in fighting the prevalence of multiple hazards. And on that particular ground, I think, as a future research, given that there are limited resources and the targeting is required, we need to figure out whether we can use statistical model-based identification of households with vulnerable children. So targeting can be more effective, and we can design intervention specifically to cater the most vulnerable children in these households. And presently, NORC is already exploring such research, and we will be able to share some inputs in future, but I would love to hear from you. And I think I'll stop here and open the floor to my colleague Letitia for presenting findings from qualitative assessment. Letitia.
Okay, thank you, Shanto. My name is Letitia, and I will be sharing the findings around the qualitative assessment. So just a quick overview of what our objectives were for the qualitative assessment. So first, to assess the overall effectiveness of the intervention categories for which we collected data, and also understanding what are the different factors that may have contributed in affecting effectiveness and sustainability of these interventions. Next, to identify some of the social norms and nuanced conditions of child labor and understand how gender might affect, geographic area might affect norms around child labor as well. Next, to develop possible explanations for the trends that we observed in our quantitative data. You'll see throughout the presentation, I'll make reference to our quantitative findings, as we found there were instances in which our qualitative findings kind of supported those and others where they differed. Next, to collect perspectives from intervention beneficiaries, non-beneficiaries, and community members in their own words. It was really important to us that we understood from both beneficiaries and non-beneficiaries what they view as challenges, how they view the efficacy of these interventions, and the opportunities that they see for the future. And lastly, to identify some success stories and opportunities for improved program implementation or future expansion. So a quick overview of what we did. We conducted focus groups with beneficiary and non-beneficiary children and youth. Our focus group discussions with children and youth were separated by age. So we had younger children in one group, older children in another group. These discussions were also disaggregated by gender to ensure that girls and boys felt free to speak about their experiences that were gendered. We also had gender disaggregated discussions with caregivers. And we conducted in-depth interviews at the community level with community leaders, with teachers. And lastly, globally, we did key informant interviews with program implementers, government stakeholders, and donors. So some overarching findings. This is for anyone who's been involved in this work, likely understands that child labor is extremely dynamic and extremely complex, and is affected by multiple factors, including gender, geographic area, other external events. Another thing we found was that the implementation of awareness campaigns have had a very strong impact in affecting knowledge around child labor, but we found that there were still some lagging in terms of attitudes and practices around child labor. Next, we found that messaging around child labor, particularly in terms of awareness campaigns, it must be tailored to community-specific contexts, and it must be personalized in some cases. And lastly, stakeholder engagement at the local level especially is really critical to creating interventions that are well-informed in their design, the implementation, and in terms of outlining realistic objectives. So moving into some summary findings. So first, beginning with awareness campaigns. So we did find that they've improved knowledge around child labor and hazardous labor, but attitudes and practices are still kind of falling behind. So during our discussions, we asked all respondents, have you been exposed to a child labor campaign? Where did you see this? And what do you think of it? And one interesting finding from the question around what do you think of this is that caregivers perceived campaigns that focus more on the health of their children more favorably than those that focused on the punitive measures for engaging a child in child labor. So for example, we have a slide here in which we see two different anecdotes from caregivers. And in the first, you see that the messaging they received was around, if you engage your child in child labor, you will go to jail. Someone will call the police and you will be in trouble. So here, the primary motivator is, I don't want to go to jail. I don't want anyone calling the police on me. So this is my motivation for not engaging my child. In the other example, the messaging was focused around, if your child is engaged in these types of activities, this has an effect on their health, and making that clear connection between this activity, such as heavy loads, for example, can affect their physical development in this way. And you also see that in this example, the caregiver was trained in worse forms of child labor. So what we're seeing is that caregivers can, in referring to child labor messaging, they're very, very conversant in some of the terminology around it. They're aware of the differences between child labor, hazardous labor, and all of these other components. However, messaging must make some considerations in order to be received well. Next, we found some differences gender-wise in terms of child labor practices. So during our discussions, we asked children, what kind of activities do you do when you help your parents? How often do you go to the farm? And just to what kind of activities do your friends do? And what we found is that boys reported more engagement in actual cocoa production activities that were more labor intensive. So these include land clearing, use of agrochemicals, sharp tool use, whereas girls were more involved in activities that supported cocoa production in other ways. So they would care after their younger siblings. They might be tasked with bringing water to the farm or bringing food to the farm. And although they were spending about the same amount of time, or reported spending about the same amount of time working, there were some significant differences in terms of what they were actually doing when they were working. And next, one of the questions of this assessment was to understand that, do children feel that their work is more important than their education? Do they value education? Or what is their relationship to education? And how does it compare with their relationship to work? And what we found is for the majority of children, they saw their engagement in cocoa production as a means to support their education. So they felt education is very important to me, and this is how my family supports me. And therefore, if I support my family in this endeavor, I will also have my education supported. Okay, and then next we're going to discuss school-based interventions. And one of the things that a lot of respondents mentioned, both at the community level and at the implementer level, is a huge challenge for beneficiaries is just the lack of school in a community. And we received several anecdotes from community leaders who said, for many parents, it's not that they would want their child to come to the farm with them, it's rather where else are they going to go? So at least you know, if there's a school in the community, my child is safe, they're with their teachers, someone is watching over them from this time to this time. Whereas if there isn't a school or the school is too far, it's much more likely that they will take them to the farm just to be able to keep an eye on them and then consequently maybe engage in some work. So with this in mind, we found that school-based interventions were really powerful in promoting accessibility to school. We also found that improved access to schooling, improved infrastructure. So there were several interventions that focus on rehabilitating existing school structures, installing water sources, installing electricity. And we found that for those specifically that focus on rehabilitation of existing structures, this had more significant impacts for girls. In many of the communities in which we did discussions, girls during school hours were tasked with fetching water for the school grounds. And oftentimes the water source was located very far from the school. And consequently, girls were missing school and missing classes, and missing class time and falling behind. And this is a perspective we got from both children and teachers. And so the example here, we see that the construction of a well in this particular community had an impact on how much time girls are spending doing this. Next, we found that school feeding programs were extremely impactful in promoting school attendance as well as performance. So we received several anecdotes from teachers where they said that in many cases, students were either falling behind in class, not able to pay attention in class. Once hit around noon, their attention would just taper off. And in some schools where were sent home for lunch, for example, there were several students who just were not coming back after lunch. And as a result, they would miss the rest of the school day. And in some cases, during the rest of the school day, would go to the farm. So we had several anecdotes from teachers where they said, having this school feeding program has helped students focus. It's helped them to stay in school as they're not going home during their lunch hour. And overall, and this was something that community leaders also said was really impactful. Okay, we also asked questions around the extent to which youth had received occupational safety and health training. And we found that for those who did, they found it to be very useful and felt motivated to implement what they learned during the training. But in terms of barriers to actually being able to implement, the first most cited barrier was just the unavailability of protective gear. So as much as I understand that I should be wearing boots or using protecting my face during spraying exercises, not having those items makes it impossible to. We also found that where youth were able to implement those changes were reported more among boys than they were with girls. And this correlates with our previous finding where there were differences in terms of the activities that boys and girls do, including more agrochemical and sharp tool use among boys. And then lastly, we found that for youth another barrier to using protective gear was simply that their parents didn't receive the training and didn't necessarily see the value. So we had some anecdotes where youth said, I really want to apply this training, but when I tried to have a conversation with my caregiver, they didn't see the utility of it. Okay, next we assessed the impact of livelihood services, and we asked respondents, what kind of livelihood services have you received? And several respondents indicated having received GAP training. And these households reported reduced costs associated with pest and disease management, as they now have the training and the tools to be able to address these. More consistent agrochemical use. Again, this also correlates with our findings around increased agrochemical use among children. And next, respondents reported that the labor savings practices that they had learned as part of GAP training reduced the amount of time that their children were spending on farms, as they were able to engage in these activities more efficiently. So here we have an anecdote from a caregiver who was talking about how learning how to plant in line has had an impact on the time their child spends on the farm. Next, we had some communities that reported participating in Village Savings and Loan Association programs. And for these, they reported improved access to agricultural financing, which is important as it allowed them to reinvest in their farms, purchase newer or better tools for cocoa production. Next, improved ability to hire day laborers to support farming activities. So again, we have another anecdote here where they say, because of the additional income I was able to generate as part of this VSLA, or the credit access I had as part of this VSLA, I am now able to hire day laborers and engage my child less. Okay, and next we had some overarching findings around the different factors that contribute to overall effectiveness. So first, we found that interventions that promoted beneficiary participation in planning and implementation were most effective. So within the school construction rehabilitation initiatives, there were several respondents who said, this NGO or this organization came to us and they said, we're going to build a school, or we're going to build this type of infrastructure to support education. And then in some cases, they were also encouraged as a community to identify, okay, what else do you need? We have the school structure, but we recognize it needs a well. And how do we mobilize as a community to raise the funds to produce that? So that was a strategy that some implementers used to kind of promote that beneficiary ownership. And we found that that really affected overall effectiveness. Next, in terms of effectiveness, we found that child protection and monitoring committees were really, really critical in amplifying and personalizing messages around child labor. So even though the majority of respondents had been exposed to some type of child labor awareness campaign, it resonated much more when it was coming from a community member. So in most cases, the child protection and monitoring committee members reside within the community. They have prior existing relationships with community members. And so instead of saying, broadly, you shouldn't engage your child labor, it can more say, you know, I saw that Letitia was missing school and was spending time on the farm. Can we talk about how to make sure she doesn't miss school again? All right, next, engaging existing leadership structures within the community. So engaging community leaders, faith leaders, women leaders, youth leaders within the intervention also helped promote beneficiary ownership and thus affect overall effectiveness. And we also found on the flip side that interventions that took a top-down approach were much less effective in gaining buy-in and having longevity within the community. So we had some instances where community leaders stated that this organization came in and they essentially just informed us of what they were going to do, but the conversation around how we can be engaged in that did not take place. Next, we found that intervention coordination was also essential to effectiveness. So earlier, Shanto talked about how the importance of having multiple interventions within the same community, and this is supported by our qualitative assessment as well. But additionally, having multiple interventions of the same kind within the community was a barrier to effectiveness. So we had a few communities in which they said, there are 3 organizations doing this one activity, there are 4 organizations doing that type of activity. And community leaders especially felt that there needed to be much more coordination with local authorities and community groups to ensure that the activities that were taking place were not duplicative. All right, and then moving on to sustainability. So some strategies that we found in terms of that were already being implemented to promote sustainability. So the example I discussed earlier around community mobilization to supplement material support. So this was something that we saw in the school construction and rehabilitation programs, where community members were encouraged to kind of supplement what they had received with their own funds and with their own initiative. Next, we've found that teachers especially saw that there was an opportunity for collaborating with caregivers around child well-being. So in some cases, there were trainings that were being provided to children within school around, this is what hazardous labor looks like, this is what child labor looks like, this is how to talk to your parent around that. But in the communities where that conversation was also happening with the caregivers, that was a really unique opportunity to facilitate that relationship between teacher and caregiver, and to also ensure that teachers felt more comfortable talking to parents about either school absences, especially when they were over a few days or during the peak season. Next, we found that child protection committees were key to promoting sustainability, as well as they facilitate community-specific messaging around child labor, as mentioned previously. And the fact that these are community members and they are invested in the community and have prior relationships with these community members, as long as they receive the training, if the intervention were to leave the community, those members are still there and still have the tools to conduct their responsibilities around monitoring and child protection. Next, we found that at the national level, respondents found the conversations that take place within steering committees or working groups around child labor to be a key factor in promoting sustainability, because these conversations were critical to understanding, okay, what is taking place, what is working, what is not working, and these platforms are also a way to promote intervention coordination. So now thinking of future sustainability. So one, incorporating awareness efforts into other activities. In a few of our respondent communities, there were some members who discussed having received training around child labor within their GAP training. So the extension service agent comes to their community, talks about inline planting, talks about proper pesticide application and all of those things. However, there's also a module on child labor awareness and hazardous labor awareness. And we found that that is a potential strategy for promoting sustainability. Next, more material investment in income generating activity interventions. Here we're thinking about skills training interventions that aim to identify other income generating activities outside of COCO during the off season for beneficiaries to engage in. But in thinking of these, we also found that there has to be very careful consideration of the types of products that are generated within these activities, because in some cases we found that community members were all kind of trained in this one skill or in this one product, but there's no ability to sell or to have the capital necessary to get that business off the ground. Next, in promoting sustainability, engaging community leaders early on in the intervention, again, including women leaders, youth leaders, faith leaders, is really, really critical to ensuring that the intervention activities are relevant to the community, and then community members have the tools to carry forward the aspects of the intervention that they find most beneficial. Next, creating open and early relationships with government partners. Several implementers said that this is a strategy that they use to promote the sustainability of their interventions, but also felt that this is something that should be applied more broadly, as it wasn't a practice that necessarily all implementers were engaging in. And lastly, maintaining and participating in national plans of action, steering committees, all of these were really critical to promoting dialogue around child labor, but also looking at how dynamic child labor is and being able to keep up with those changes in a way that is informed by the realities on the ground. All right, and that's all. Thank you.
All right, I want to thank Letitia and Shanto for their presentations as well. There's so much information in this report and in these data sets. Honestly, this was just the tip of the iceberg on what we could answer or could present here. I encourage everyone to make judicious use of the table of contents in the report to get to information that they would find important and that they can use. And we're also going to be making the data available as well, so that other researchers can go in, you can grab the data, and you can do all sorts of analysis. We did receive multiple questions during the presentation. So I'm going to try to go through some of the big questions. And then if we still have time, hopefully people can raise their hands and we can, open it up and you can ask questions as well, if that makes sense. But let me jump in right into it. One question we had is around the definitions of child labor and hazardous child labor, and whether the governments of Ghana and Côte d'Ivoire accepted those definitions. So the definitions were set as part of the Harkin-Engel Protocol. And in terms of the 1819 round, we had to stick to those definitions in order to compare the results, over time. That was a contentious issue at times. We also have local definitions in the report using the country-specific definitions of child labor and hazardous child labor. So we collected, two different metrics, one local and one international, so that you can then go in, the governments of Côte d'Ivoire and Ghana can use the information to understand how things look using their national legislation. And then we can also compare over time. The most interesting, finding coming out of that is that when we use the local definitions, child labor and hazardous child labor prevalence is even higher, right? So the governments definitely, when they designed their child labor laws, made them very strict. And I encourage folks to go to the report and they can see, exactly what that was. And I believe that's in Annex 10.3.2 and 10.3.3, as well as the main report. We've got a crazy numbering scheme in here, and trust me, at first I was skeptical of it, but the only way to get to the information is to do it that way. So I encourage people to go there and seek that out. People were asking about breakdowns of agrochemical use by age group. That's also in the report, section 5.3.2, table 54, as well as in the annex. We can't present everything here, but we've got all this information there. A question came in asking about how to deal with the underreporting of child labor when asking the head of household or the child. So our survey focused on the child. We did not rely on the head of household to determine whether or not a child was in child labor. We entirely depended on the child themselves. We did, before we started any interview, we had a short cognitive test that the children took so that the enumerators can understand how well they could understand particular questions, because sometimes it's difficult, especially for the 5 to 11-year-olds. And oftentimes a parent or an older sibling would help explain the questions to them in a way that they could, understand as well. People were asking about exposure to hazards. And again, we go into it in detail in the report. I encourage you to go in there and find the information. Also, you can feel free to reach out to Shanto and myself, and we can answer any specific questions or even have short meetings with people if they want to get more information, on that topic. What are the characteristics of households where children were engaged in 4 or more hazards? So that's not something that we did in this report, but as Shanto pointed out, this is an extremely important, thing for future research. We're working on it right now, trying to come up with a way to proactively identify the most at-risk households so that we can tailor and focus interventions at those households. And I think that's one of the key takeaways from Shanto's presentation that we should be aware of. Let me see. A lot of details about, the 6 or more interventions. There's information in the report. We can't pull it all out right now, but again, if you email us, we're more than happy to answer any questions in more detail, at that time. There's a question about children of migrant farmers, sharecropping farmers, and farmers that don't own land, and those children being the most vulnerable. Although we didn't focus specifically, on those children, I think it would be important in the future to break that out so that we can understand exactly, the different types of children and who's more at risk and who's less at risk. We were bound both by previous survey rounds, as well as I said, this survey could last 3 hours, and we had to make a lot of hard decisions about what we could include and not include in the actual survey. We'll also, I think we can share these slides with everybody. We're also recording this, and we're going to put that recording on the website so people can refer back to it. There's a question about how the Harkin-Engel protocol impacted trends of child labor. So we can't say anything definitively, right? We don't have the data, nor was it our mandate to specifically look at the functioning of the Harkin-Engel protocol. What I can tell you is an outside observer who was allowed to look in and see how it functions. I think it's a great structure to bring country, stakeholders, international business, the US Department of Labor, international organizations, all together in the same room over an extended period of time, right? They had meetings at least once a year. We had meetings with all of the principals multiple times throughout the program, and everybody was talking to everybody else during this. And as you know, the most interesting thing about these meetings are the sidebar conversations that take place, right? So you'll be in a meeting and then the International Labor Organization is talking to UNICEF, is talking to the governments, and everybody's like, oh, let's have a meeting, let's do this, let's do that. And it just seemed like a really nice structure for bringing all these groups together. There is a question about the comparability with the Tulane previous survey rounds. We are able to compare the prevalence rates across time. So you'll see in our report, that's really what we focus on. We've got population counts that we think are super accurate for 2018-19. However, we're unable to look at the previous reported population counts, and we don't make any claims about changes in population counts, simply in terms of prevalence. And I'm not even I don't want to even conjecture on what that might look like. Increase in agrochemical products. So I can't remember if, I'm sure we looked at it by stratum. Shanto, do you recall if there was a difference within the stratum for that? For agrochemical use, was it higher in the low and medium areas?
I don't think we have presented it there, but at some stage we do look into that. But that can be done from our data, so it can be extracted.
So honestly, I feel like the important takeaway here is that there's agrochemical use across the board. And it's simply a question of whether or not communities in the medium and low production strata have been made aware of the impacts, right, of agrochemical use. I grew up in the 70s and 80s, and it was all about put trash in its place, right? To the point today now, if I see somebody throw a piece of trash on the ground, I have a visceral reaction to it, right? And it needs to be the same kind of thing, you know, with these children. Parents don't necessarily understand the risks of agrochemical use, right? So raising that awareness, I think, you know, and again, this is just from our own personal view, you know, would really benefit children on the ground. There's lots of questions about the multiple hazards, which is great. Again, we think this is one of the most important findings coming out of the report. It's very complicated. I encourage people to send us questions about that so we can get all of the data rather than just speaking off the cuff, because it is a complex issue. Okay, so lots of people are very interested in, you know, why was there, so I don't know how many people are aware, you know, we did a draft of this, the draft was leaked, you know, the numbers were slightly different in the draft, and people are trying to understand why it shifted. So from 2 million to 1.56 million. And that's because we identified an error, and in order to make the results as accurate as possible, we corrected for the error. I want to just keep one thing in mind. Does it really matter whether we say 1.56 million or 2 million? Because it's an issue either way you look at it. It's not as if people are saying, oh, well, it didn't reach 2 million, so everything's okay, right? Our intent here is just to be as accurate as possible, and that's the only, you know, the only thing we have invested in this. Let me see. There's questions about the rule of law. You've got to understand that, and it's not just in this project, we, you know, do studies all over the world. Trying to build up a child protection unit in a government is an expensive and time-consuming task. So yes, that is something both governments are trying to do. And I think it's a good thing as well. But if people are funding those sorts of programs, they have to think about sustainability, right? And building up the capabilities and sustainability of those programs. And yeah, they would be a big help. Hold on now. There's questions about forced labor. Again, we didn't study forced labor. I think this is a fantastic issue that needs to be studied further. I would encourage folks to talk to the International Cocoa Initiative. They do they've been doing some work around that, and they have a lot of good answers. The methodology, so we used a household-based sampling approach. Using a household-based sampling approach, you're not going to get, you know, forced labor, child trafficking. That's a hidden and hard to reach population. And you would need to use methods, you know, designed for hidden and hard to reach populations to get at that. But I definitely encourage that as a very important part of future research. There's questions about global demand and child labor. It's really difficult. We're not, you know, experts, you know, in that field. So it's very difficult for us to say anything. I would just keep going back to the Harkin-Engel protocol as a really strong structure for bringing all these people together to try to confront this issue. There's a question about income-based interventions. So we did see some livelihoods, you know, training had some, you know, impact, as you can see in the report. It had an impact on child labor, but not on hazardous child labor. So it goes back again to the idea of if your child is in child labor, then most likely they're also involved in hazardous tasks. And of course, it's important to increase the income of farmers, but this is a complex issue. And just increasing farmers' incomes is probably not enough to get the job done. And you need more research as well. So it's not just a question of increasing the farmers' incomes. How much do you have to increase it before it changes behaviors, right? Because there's still a point there before they'll be able to hire like laborers. And I don't think anybody has an idea about exactly like what is that point. And that is something that, you know, we do on other studies. I mean, we weren't able to do it on this study, and I encourage people to do that. Let's know how much exactly do farmers make, right? And how much exactly do they need to make in order to impact child labor? I agree that that's extremely important. Shanto, do you see question 28 here?
Yeah, I think Sarah, you know, what we see here, just give me a second.
Summarize the question for them too.
Right, I think there is a question regarding the difference in two tables which we presented in the draft and which was leaked version of the draft and the final report. So the answer here is that we made a change in the way the data has been presented, given the inputs we received from different stakeholders during the draft revision. So that's why the correct numbers are there, correct, as well as, you know, the differently placed numbers are there in the final report. So that's why the numbers will not match with what was presented initially in the draft. And again, I wanted to reiterate, whatever we presented in the draft was for the purpose of discussion and further revisions. So you might see some differences, and I don't think it's like fair enough to discuss about those now.
There's a question about whether the interventions were just industry interventions. So there's a lot of people that are very interested in what is the industry doing, but the answer is no. We looked at all interventions across partners, the Department of Labor, national governments, NGOs, and industry. I think the key takeaway here, and forgive me if I get it wrong, is less than 20% of the villages that we visited had any interventions, or less than 50% had any interventions at all, right? So, I mean, the takeaway there is scale up, you know, what's happening to reach these villages that have never been touched, you know? And then again, that goes back to where we were talking about identifying at-risk communities and perhaps having better tools for identifying those communities so that we know that our impact is having, you know, is very focused.
And Karim, I just wanted to add something here very quickly. And again, that goes back to the whole discussion of like the dosage and, you know, what type of interventions are effective and not. But I think it is very important to understand that there has to be complementary set of intervention. One intervention, for example, only livelihood support may not be effective in reducing child labor because of the complementary nature and the complex problem of child labor. And that's why, like, you know, we definitely need to expand more of this type of interventions where multiple complementary approaches are taken together. For example, there has been some findings, you know, not from our study, but from other studies, is that the child labor protection, like child labor monitoring and remediation services, which are presently implemented in many communities in Ghana, has significant impact. So where it is a kind of, you know, supply chain based approach where a lot of things are considered, not one particular type of intervention, and a lot of importance is given in identifying the household. And there has been, like, you know, evidence of some impact of that. So we probably need to think more on the ground, a holistic approach, and specifically expanding that holistic approach to most of the communities. And, you know, irrespective of whether it's a high production area, because that's an important finding that we have. Even if a particular community is presently not producing much, we need to be proactive, visualizing that in future there will be problems. And that's why we need to start early, and so that we can actually prevent those things from happening. Over.
There's several questions asking about the cultural context and understanding what does child labor mean for the people on the ground, and whether or not we considered that. So for the first point, we were kind of bound by the definition since we had to compare data longitudinally, and we couldn't go back and change the definitions in 08, 09. So we had to carry those definitions over as well. Are there problems with the definitions? What do people on the ground think about them? So what I always found interesting, if you ask the people on the ground, what do you think about child labor, right? Is child labor wrong? Unanimously, you have them say, yes, it's wrong. Oh, we don't have that. We don't like that at all. But then when you start defining it for them, they didn't understand what I meant by child labor, right? So keep in mind, as part of this study, a 5 to 11-year-old, and let's focus on the 11-year-old. If an 11-year-old spends more than 1 hour in the course of a 12-month period on the farm, then they're considered a child laborer. And if I put it that way to the farmer, right? Oh, your 11-year-old can't go to the farm even for an hour over 12 months. Then they'll say, oh, well, no, that's not what I understood it to be, you know, and they would have issues with it. However, and I completely agree, for international, you know, reasons, right? And in order to compare these things across countries, and in order to address these issues at the international level, you have to come up with a standard way to understand them, right? And then you start getting into debates, you know, and these aren't debates that I'm not part of that debate about at what age do you cut off? How many hours, you know, can a child work? What does it mean to be working? You know, and all of those things. So I think it's a continuous discussion people need to have and an important issue as well. Shanto, question 41.
Just give me a second, let me read it.
Okay.
There's a question on whether we have studied the displacement effect and what are the consequences of various hazards on health. And we looked into the prevalence of child labor and hazardous child labor in land clearing, as deforestation in cocoa is highly challenging. Our answer is that we did not directly study the displacement effects. And in terms of the consequences, we do have a section on health hazards. For example, what type of injuries are suffered by children working in agriculture. So we presented the data. And we do have information of types of activities considered, for example, land clearing activities done, but we do not have a direct way of linking that. I think like looking into the areas, probably, you know, it can be done, but that's not part of our report.
So maybe we can let people raise their hands and we can try and take a couple questions. I'm not gonna let people make speeches. So just be prepared. If it starts to turn into a speech, we might have to mute you. But if you do have questions, please raise your hand and let me see if I'm able to take them.
And Karim, in the meantime, I just wanted to also mention that there are some questions which we have not been able to address here directly because of, you know, overlap with other ones. So probably we'll try to, you know, create a question answer and try to share it later on as much as we can do based on what we received today.
Yeah, I don't see a lot of hands raised. So let me know if you see some. Let me see some of these other questions we have. Somebody has a question about how to impact attitudes and practices. I know just both from this research and also there's been a lot of research done around awareness campaigns. Awareness campaigns that focus on the positive are more successful than ones that focus on the negative effects of whatever, you're looking to impact. So I know that's a big plus. Awareness campaigns by themselves, I do not think are super effective, and they need to be coupled with other types of interventions in an entire package. And I think this is something else that we've been saying, right? One type of intervention is not the way to go. You have to have multiple complementary interventions that are all speaking to each other. And also so there's two types of interventions. One is at like the government level, increasing their ability to, understand child labor and track child labor. And I think that's great. But then on the ground, the closer you can get to touching individual communities, households, and children, the more effective it's going to be, right? So if the interventions can really get into the household and really interact with both the parent and the child, I think that that is highly successful. Okay, I guess I was muted for a second there.
And Karim, just to follow up on that, maybe we have significant information, for example, from the qualitative assessment that Leticia presented, specifically focusing on those grounds. For example, if occupational safety and health training is provided only to the kids, but the parents are not involved, then we don't, the kids mentioned that it was not very effective because their parents didn't know, exactly how to address those. And that's where the complementarity and inclusion comes in. And I think our report has, specifically the qualitative assessments part, has a lot of information. I strongly encourage you to all to look into that. And we will be happy to address any further questions, because as you know, like in a 300-page report, it is very difficult to address multiple findings that can be interesting to others, but not directly flowing to the objective of the study. So please do read those qualitative sections carefully. And if you have any further question, we'll be happy to address that in future.
Okay, we've got Leticia, please.
So I just wanted to make a very quick clarification around, there was a question I saw there that was about, for Ghana, the linkage between education cost and cocoa production. So wanting to clarify that this is specific to, we were aware that there was an initiative by the government to make primary school, I think up to SHS free. And so this is referring to some of those other costs like uniforms and other materials that were specific. So that was specific to Ghana. And in terms of the OSH training, we only asked those questions to older youth. So we did not ask those questions to younger children. There was a comment about how, children shouldn't be working anyway. So why would they be provided with that protective equipment? We only pose those questions to children who were at the age where a certain number of hours is considered allowable. So above 11.
Okay, I see that there are some questions. Yuki Low from the Freedom Fund. Let me see if I can unmute you. Can somebody unmute Yuki?
Hi, thanks so much for the presentation. I'm interested, I know you worked with World Cocoa Foundation, on this study. So I'm wondering, what is the recommendation from this study about what global brands and these certification schemes could be doing? And to what extent is this about, the farmers don't take up good, safe practices, or is it more a structural issue that the price of cocoa beans don't allow them to afford these practices or better practices?
I would say all of the above, right? So there needs to be more effort by the industry, there needs to be more focused interventions by NGOs and CSOs. And there's no one, size fits all answer here. I think increasing farmer incomes would help, but all by itself, it's not going to do anything. I think certification schemes could be successful as well, if they can be implemented. We need to hit it from multiple angles, working together all at the same time. I hope that answered your question. Nicola, can we unmute Nicola?
Hi guys, fantastic study. Congratulations on getting it published. For the benefit of everybody else here, I wondered if you could talk more about how you actually conveyed a lot of these concepts to children. So I know you guys put a lot of work into the heavy load stuff and the recall periods and the anchoring kids, because I think this is an element of survey design that's completely under sort of appreciated when we're designing these studies.
Yeah, I mean, I could do a 2-hour presentation just on how we trained enumerators. And we had something like 21 days, of training overall. And I'm just trying to think off the top of my head now, heavy loads is an interesting construct. It's extremely difficult to get across. And in order, I felt to be, as accurate as possible, honestly, is we simply asked the children, what does heavy mean to you? And we asked all the children that. And then we had a sample of over 5,000, so we feel like we kind of have an accurate idea there. Otherwise, you have to go out there with scales and weigh things, whether they're wet, weigh them when they're dry, try to figure out whether they're pushing them uphill, pulling them downhill, what kind of distance are you covering? It becomes extremely difficult.
I just wanted to add something here. As Karim mentioned, we have two definitions used in the report. So in the common definition, which we have presented throughout the report, the heavy load was self-reported. We asked the children explicitly the question, have you carried any heavy load? But for the national, the definition, we did collect information on different metric that was specified. And we did ask them how, what was the size of the back bucket and what did you do? Have you pulled or something like that? So it was extremely challenging, and it took probably 35 minutes for that particular section to be implemented on the ground. But we do have information, and in order to maintain parity with the previous round of surveys, we did use the self-reported data because that's what was done in previous round for the comparison purpose. But there is information in the survey which can be used, if you look into the measurement itself. But again, that's extremely, extremely challenging to identify so many different components and so many different possibilities.
Anna, can we unmute Anna?
Yeah, thank you. This is Anna from ICI. Thank you very much for the great presentation. One thing that wasn't quite clear to me on the assessment of intervention part of the study. So you keep mentioning that from the quantitative findings, you conclude that multiple interventions or specific combinations of interventions are somehow more effective than a single intervention, and wasn't just quite clear to me how that conclusion is possible from those quantitative results, if you could explain. Thank you.
Okay, so let me take that question. I think there is again, we can have discussions later, but basically what we meant is that if we need to look into one particular intervention compared to many others, it becomes methodologically very challenging, specifically given that our design was retrofitted because it was not before the interventions were implemented. All we did is that given whatever was done, we tried to retrofit statistical models to say what can be said out of that. So from that particular perspective, given the sample size limitations and its further implication, and again, it's a more complex discussion, so I'll refer you to look into the report. What we said is that based on our understanding, multiple interventions will probably have more impact, and it is probably easier to detect given the sample we have. However, we cannot make a direct conclusion saying that one single intervention versus multiple. Maybe it's possible that one single intervention, the golden intervention, can reduce child labor by, let's say, 30 percentage points. Whereas a combination of 7 bad intervention might, or 7 ineffective intervention might lead to only 5% or 10% change in child labor. So that comparison, I don't think we have made it. And it is not even methodologically feasible to do that. For that, we need a very separately designed study. Probably randomized control trial can only, shed light on that particular question.
Judy, do you have a question? Can we unmute Judy?
Hi, thank you very much. And congratulations on this massive undertaking that the study represents. I wanted to ask about the children found not living with their parents or relatives. I believe it was 94% of the children do live with parents or a family member. And so that leaves 6%, which is still a pretty significant number of kids. And I'm wondering if you're able to cross-hatch those children with other indicators such as the number of hazardous forms of work they're engaged in, things like that. And then building on that, what would it take in the future to include a more conscious review of some of the risk factors of forced labor? I understand your comments earlier about you would need to have a very different study to actually go in and find forced labor, but I think it would be interesting, at least when you're out there doing this data collection, to be looking at more consciously some of the risk factors.
Shanto, do you want to?
Yes, so for the first part of the question, Judy, we do have information, as we mentioned, like 6% of them are actually not living with the families, but some information we gathered, actually we looked into that, even though that's not presented in the report. So we asked them, like, for what purpose you are living without your parents? And mostly, according to the data that we have, and again, on the top of my head, most of them say that either they have come for education purpose, living with the non-relatives for access to education. And in some cases, very minimal cases, at least the self-reported information showed that they came for work. And I think it is feasible to, again, as Karim was mentioning, to identify the extent of the problem. Probably we need a different type of survey to be done. Household survey may not be very complete in terms of identification and proper detection of that. But we have some information that can be used. And with the 6%, even though I'll be a little worried in terms of presenting or disaggregating the data, but that can be done. And again, that's the point Karim and I have been trying to mention, that we did collect so much of information in our survey, and probably we have not even used maybe like 20-30% of, more than 20-30% of that data. So I would encourage all of you to look into that once it's going to be made public very soon, and then do all of this potential analysis. And we'll be happy to address questions if at that stage, whatever we can.
And most likely we're going to hopefully have the data available by the end of this week or early next week. And I'll send out to everybody on here when that's ready. And please come get some free data, because it's a really strong data set. Martha, can we unmute Martha?
Hi, thank you so much. Martha Saldinger from Winrock here. Such rich presentation. I wanted to go back maybe to some of the qualitative findings about multiple implementers and see, Letitia or anyone, whether you can speak more about whether you learned that it was a lack of coordination that could be a barrier or a problem in communities, or was it just the actual multiplicity of implementers, which I think would be very relevant to us implementers in the field as we do try to coordinate and look at how we can make donor dollars, funder dollars go farther and not leave anything on the table.
Thank you, Martha. So for this, we are referring to instances where there are multiple implementers within a community, but they're not coordinating around their activities. So in a few communities, we had community members say, oh, this initiative came to help us begin a VSLA, and so did this initiative. And there were some groups where it was almost half and half were involved in different VSLA activities and had different kind of feelings about their participation in them. But more importantly, at the community leader level, they found that when there were some cases where there were multiple implementers doing similar interventions, but coordinating around those things. So this recognition that, okay, you may have, you and I are doing similar activities, but if there's someone who wants to receive gap training, for example, and that's something that you don't offer, you can refer them my way and vice versa. But when those were not communicating with one another, what happened is that it left community members confused sometimes. So you hear information about a new VSLA and you know nothing about another one, but perhaps your neighbor is involved in the other one. So in thinking about now which ones should I get involved in without really an understanding of this is what this one offers, this is what this one offers, this is how they're similar, this is how they are different. And the person who's running the activity itself also can't tell you that this other VSLA is here and they're doing something similar, but this is how we are different. So that's where it became an issue in terms of one, identifying for community members, which one is for me, to gaining buy-in, and at the community leader level, communication around those interventions when they weren't coordinating, it was just much more difficult.
Sylvie Lane?
Yes, hi. I have a question about how you can compare the production increase with the increase in prevalence. I'm wondering, do you have information on how the production increase spreads over time and how that compares to, for example, growth in cocoa growing households versus productivity increases?
Yeah, so I'll let Shanto talk about that a little bit, and maybe I'll follow up then with some more information.
I think that's a very important and interesting question. And, unfortunately, that requires a different type of, methodology to assess that. And while we do have some data to do that, because we collected information about their cocoa, farming, including the expenditure on different types and different inputs. So we can basically model a production function, which we call as modeling production function, to find out what proportion of production is linked with different components of labor, for example, adult labor, child labor. However, it was not objective of the study, so we haven't captured that, but I'm pretty sure that that can be done based on at least, the data we have. It probably may not be sufficient, but we can at least do a dig up on the data. Prem?
So I was just going to say it's difficult for us to compare counts across time, but just anecdotally, we did see an increase in new cocoa farms, right? So that was part of it, and then there's just the strength of the trends that we're seeing in the data. Some of these things just pop out, at us. We've got a question from Fernando.
Hello, Fernando Morales de la Cruz from Cacao for Change. Thank you very much for listening to me, and especially thank you very much for your amazing research. I basically believe that we have a very serious problem in the cocoa industry because the cocoa farmers are being paid less than 1/4 of the price of the cocoa in the 1970s. So if the price has been divided by 4, it is obvious that there is misery, hunger, malnutrition, and an increase in child labor. So I would like to propose a very simple solution, because I think your findings are devastating. Child labor has increased, and it will continue to increase as misery, hunger, malnutrition are a consequence of price. So I think that the biggest problem here is that we have to start proposing solutions. And the main solution is not to police the child labor, even if we had an army of people protecting the children, but basically to create a virtuous business model that could actually eradicate poverty, which is the cause of child labor.
So sorry, I muted you real quick. We're really avoiding speeches, and we do not think that there's one root cause of child labor, and that includes poverty is not the only root cause. There is also not, in our view, is at least not one solution, but rather multiple complementary solutions working at every single point in the value chain in order to affect change, right? And I feel like the most important thing needs to be trying to impact the lives of the children in cocoa growing areas. In order to do that, you have to, I believe, look at it at every different point in the value chain as well. And sorry for muting you, but we're just trying to, make sure as many people can ask questions as possible. Paul, that might be from COCOBOD and the government of Ghana. Paul?
Yes, can I have the floor?
Yeah, you can ask a question.
All right, thank you very much. I wouldn't have asked this question on this platform, but I think somebody raised that question and the explanation came out and it's so confusing. There is issue about cocoa production and the correlation to that of child labor. I think an issue that was discussed at length, but also went ahead to put up that statement in the report. You see, we draw correlation between productivity or production, but there are so many factors that determine how a farm produce increases. But we are drawing correlation of a child labor, so cannot distort the adult labor components of that productivity. How many adults contributed to that productivity? Thank you.
Right. So this was a concern of the government of Ghana throughout the process, and it's a valid concern. Is they don't want, they don't want people thinking child labor is driving production, right? And that's not what we're saying in our presentations or in our report, right? We're not saying that it's the child labor driving production. We're saying production is increasing, right? As there's new farms are expanding into areas that were not, saturated with cocoa before. Those new farms have children, right? As more and more people are working in the cocoa sector, right? You're going to have more adult laborers, you're going to have more child laborers as well, and that's the only point what we're trying to make there. So I thank you, Paul, for bringing that up. It is an important issue. I'm looking at some other questions that came in. Somebody asked about what happened with the children identified in child labor, and how did we handle that? So I think that's important, very important. When you're doing vulnerable populations research, first and foremost, it's about, not doing harm. And we had very extensive protocols in place. We call them, response protocols for when we're confronted with particular issues in the field. So we worked with several NGOs as well as government offices where we could provide referrals, to children that we found in dangerous situations. Off the top of my head, I'm not sure how many of those referrals took place. In terms of child labor, at the time of the interview, it's very difficult to assess whether somebody was in, a bad labor situation. And it's not until we get the data back and we do analysis, and at that point it's anonymous, that we can make those kind of claims. Somebody's asking if there's going to be another follow-up NORC survey. So, I'm disappointed that the Harkin Engel protocol is coming to an end. Again, I think it was a great, structure for people to come together. And I would love to be able to do another survey, building upon the 2018-19 survey and then we can talk about population counts. We can try to bring CSOs, get them more involved in the process. We can really come up and, we have to use the same metrics in order to compare over time, but perhaps we can add important modules that were missing in the previous surveys. I would love the opportunity to be able to do that. Somebody was asking about a mapping of past interventions. And that was actually the intent when we started this. However, it proved to be so difficult to get, accurate information about all of these different interventions in order to map them over a 10-year period, that a lot of that did not come to fruition. The quality of the data we were receiving from all the parties was very difficult to, present in an accurate scientific manner.
I think, Karim, I just wanted to add one sentence here. So we did receive the data and we did try to do that. However, like the breakdown of data is pretty poor. In most cases, the implementers were not sure, whether we're unable to provide the data by lower geographic level that was required for a proper and accurate mapping. So most cases we got at the national level. So it was very difficult to construct something meaningful out of those maps. And that's why, like we feel, as Karim mentioned, it is extremely challenging. And I think probably one takeaway from this for the implementers, it is very important to document every single process and make it available so that for future studies, we can get it. We had pretty hard time to reach out to the government, get information from the government, from the implementers, like industry and other implementers. And, I'm sorry to say that the level of documentation at this age is very poor. And definitely that's something can be improved so that researchers can do a much better job in looking into the lower geographic level and trying to provide insights that could be definitely useful from the implementing perspective.
So I received one last question about the expert group process. So I don't know how many people are interested or even aware of these issues. But given how important these findings are to multiple stakeholders, our report went through a expert group review, right? To ensure that our calculations were correct in all of this. The International Labor Organization graciously offered to organize that. It was done with complete transparency with the governments, industry, US dole. And part of what we came out with is that we only reported the main outcome variables of interest at a 99% confidence. And I always like to say, just think if we could go down to 95%, we'd have a 600-page report, right? So I feel like that these numbers were very well vetted through that process. The experts group did identify errors, which we corrected. And it's in the report, the whole process, their findings in detail, and we're more than happy to answer questions about that. And then somebody asked, what is our recommendation for future collective action by all of these people? Again, we're not experts on it, but just from an observer who got to peek in for 5 years, more dialogue. Everybody needs to be accountable. Everybody needs to work together, towards realistic goals around this. And it includes industry, it includes governments, everybody has to take their share of the responsibility in order to impact child labor and hazardous child labor moving into the future, right? Nobody should be left off the hook. We all need to work together and continue, on the promising things that we found, in this study.
Karim, I would like to add maybe 1 or 2 sentences here. Again, going back to the way the child labor and hazardous child labor is measured. And, we think that the metric that we are currently considering, just focusing on child labor and hazardous child labor, can be expanded beyond what we are looking into, let's say, either they are engaged in child labor or hazardous child labor. Rather, it is very important to prioritize the understanding of the multiple hazards and the frequency of hazard. I think from the recommendation perspective, like even if it is not directly tied up to the recommendation, but from the research perspective, we do see a big gap there, which we definitely would love to be addressed. So from the program implementation, design and implementation perspective, I think that's a very important area that implementers should consider, how to reduce the vulnerability with respect to frequencies, high frequencies, and multiple hazards.
Okay, I want to thank everybody, for spending this time with us. Please make use of the report, make use of the data, when it drops. We're available to answer questions at any time. If we want to get together in smaller groups, I mean, like I said, there's many different stakeholders here. Some have a different focus. Some are more interested in one thing, others are interested in another. We could have a discussion focused on those issues that you find of interest. Again, this was a process. There were hundreds of people involved, and I thank all of them, for all of the hard work that they've done over the last 5 years. And I want to thank everybody for spending a couple hours with us today to talk about this. Take care.
Thank you, everyone. Take care.
Thank you.